Welcome back to my channel Radiant Living. On this channel, I upload videos for you to remain fit and healthy. I am Dr. Pramod Joshi, MD Medicine, practicing last 44 years. In this video on thyroid, small gland big impact, I am going to share with you knowledge about thyroid disorders. I want to share a case history of my hypothyroid patient with you. A 34-year-old lady came to my clinic. She was very anxious, had hypertension and hypothyroidism. In the detailed history, I found out she had been to her mother's place in the remote village and she reported for antenatal checkup in 6th month of pregnancy. That time she was diagnosed with hypothyroidism, which was later controlled, and she had a normal delivery. But over the period of 1 year, she noticed that child has delayed milestones. And she was shocked to know by the end of 2 years that child is mentally challenged. She was very anxious about the future of the child and it could be the reason for her hypertension. What went wrong in this case? She must have been hypothyroid before getting pregnant and she was not aware about it. So hypothyroidism remained untreated in first 5 months of pregnancy. Do you know thyroid hormone is very vital for development of neural tube and later is differentiation and maturation into brain and nervous system. This process starts very early in pregnancy from second to third week and continues throughout the term. In a baby or the fetus is dependent on mother's thyroid for first 4 to 5 months because baby's gland develops around 4 to 5 months and later it is his own hormone is available for him. So in this case, because of untreated hypothyroidism, the fetus had impaired development of brain, intellect and higher function and child became mentally challenged. So what is the lesson learned? Every lady should plan her pregnancy and she must check her thyroid hormones and blood sugar before conception to avoid future complications. Do you know where thyroid gland is situated in our body? It is in the central part of the neck just below the sound box. This gland has a butterfly-like shape as you see in this picture. It has right and left lobe. They are connected by a small bridge called isthmus. This gland plays a very important role in our endocrine system. And main function of this gland is to produce hormones that regulate the gear of metabolism of our body and growth. Thyroid gland produce three hormones T3, T4 and calcitonin. T4 are called as thyroxine. It has got 4 iodine atoms in it. It is the most stable form circulating in our blood. When T4 enters liver, it is converted to an active form called T3 or triiodothyronine. And the third hormone is calcitonin, which regulates calcium levels in our blood. The normal thyroid hormone levels of T4, that is thyroxine, is 4.5 to 12.5 micrograms per deciliter. The second hormone, triiodothyronine, that is T3, is 80 to 180 nanogram per deciliter. The third hormone mentioned here is TSH or thyroid stimulating hormone. It is produced by the hypothalamus and it regulates the secretion of T3 and T4 from thyroid, and it is very important hormone we always measure for management of thyroid conditions. The normal level of TSH are 0.4 to 4.5 milli international units per liter. When thyroid gland is underactive, it produces less thyroid hormone. This condition is called as hypothyroidism. The low levels of thyroid in the blood stimulates hypothalamus to produce large quantities of TSH. When TSH levels are more than 10, it is diagnostic of hypothyroidism. The levels of TSH between 4.5 to 9.9 is called as subclinical hypothyroidism. The prevalence of hypothyroidism in India in the coastal areas is about 9.5% and in the inland areas is around 11.7% of the population. The females have 3 times more hypothyroidism than males. The most important cause of hypothyroidism is autoimmune Hashimoto thyroiditis. The other causes are iodine deficiency or thyroid gland surgery where some part of thyroid is removed, radiation to the neck for cancers which can destroy some part of thyroid gland. But what is more important for today's young population is the radiation coming from the screens of TV, laptop and mobile phones. So you have to be very alert with that. The commonest symptoms of hypothyroidism are fatigue, weight gain, hoarse voice, puffy face, non-pitting edema and hair loss. We can also have constipation, dry coarse skin, cold sensitivity, muscle weakness. Sometimes you can have depression, heart rate is usually slow and person can become breathless during walking. Very important for ladies, it can cause infertility and menorrhagia. The lipids in the blood are high elevated, total cholesterol, LDL cholesterol and triglycerides, the levels are high. Thyroid hormone is very important for growth of fetus in womb. It is very essential for development of the brain of the fetus in first 3 months. If hypothyroidism is untreated in pregnancy, we can have mental retardation and delayed growth in children. Overactive thyroid gland produce large quantities of thyroid hormone and this condition is called as hyperthyroidism. The prevalence in India is about 4.7% of the population, but females are affected 5 times more than males. The most common cause is autoimmune Graves' disease, which accounts for 60% of the hyperthyroid cases. The other causes are toxic nodular goiter, about 15% of the cases, and thyroiditis in 25% of the cases. Hyperthyroidism can cause weight loss, fast heart rate, and cardiac arrhythmias. The person looks very anxious, irritable, can have wide mood swings. The loose motions can go on and on for a long period of time. He has got intolerance, excessive sweating. We can find tremors. The thyroid gland is enlarged and is called as goiter. The eyes look wide open and protruded due to Graves' disease ophthalmopathy. The ladies can have scanty irregular cycles. Diagnose thyroid disorders, the symptoms and signs like weight loss, fast heart rate, loose motions, and tremors, they point towards hyperthyroid state. While weight gain, constipation, non-pitting edema, hoarse voice, they point towards the hypothyroid state. The blood tests are very useful. TSH more than 10 is diagnostic of hypothyroidism. The TSH less than 0.4, T4 more than 12.5 and T3 more than 180 points towards the hyperthyroid state. The hyperthyroid state we can further confirm with thyroid uptake scan with the 99 technetium tracer. If the uptake of the tracer is very high, it is diagnostic of Graves' disease. But sometime in thyroiditis, we can have high levels of T3, T4 and low TSH, but the thyroid scan shows poor uptake of stressor because of thyroid inflammation. So scan can differentiate between Graves' disease and thyroiditis. Ultrasound is very useful to diagnose thyroid nodules. The nodules which produce hormone are called as hot nodules and nodules which do not produce hormone are called as cold nodules. The ultrasound of thyroid also helps to diagnose thyroiditis. Treatment of hypothyroidism is by replacement with synthetic T4 hormone. We adjust the dose of T4 according to the levels of TSH, which we do every 2 to 3 months. If a hypothyroid lady gets pregnant, we increase the dose of T4 hormone by 30 to 50% and check TSH every month. For good control in males and non-pregnant females, the TSH level should be between 2.0 to 4.5. And the ladies who are undergoing infertility treatment, we keep the levels of TSH 1.0 to 2.0. In pregnant ladies, in the first trimester, we maintain TSH level between 0.1 to 2.0 and in second and third trimester, we keep the TSH levels between 0.3 to 3.0. For short-term treatment of mild to moderate hyperthyroid cases, we advise antithyroid drugs like methimazole and propylthiouracil. Beta blockers we have to use initially to control fast heart rate and tremors. For long-term treatment, those who have completed their families and not going to have further children, we advise them to radioactive iodine therapy, where radioactive iodine is injected in the blood. It goes and attaches on the hyper-functioning thyroid cell and destroy them so that some mass of excess functioning thyroid is lost. Gradually the function comes to normal or sometimes we have to give small replacements of T4 thyroxine. Those people who are in childbearing age and want to have children, and if they're mild to moderate case, we advise them to continue with the tablets, and in severe cases we advise surgery, hemithyroidectomy, that is removal of half thyroid. In both these procedures we have to regularly monitor T3, T4 and TSH level and adjust the dose of antithyroid medications. Now, after watching this video, your knowledge is enriched for hyper and hypofunctioning thyroid disorders. Do like this video, share it with your near and dear ones in your friends circle and groups. Subscribe to my channel by pressing bell icon. My sincere request to the young newly married ladies, do plan your pregnancy properly. Check your thyroid and sugar before planning pregnancy. See you in the next video.